in gynecology. I work in primary care setting, and then I also work in gynecology as well. And in my gynecologist office, we do genetic testing. So if they do have that family history of cancer, we actually do like a MyRisk genetic testing that tests for genes. These are certain mutations in the blood, and it'll tell us if you are positive for those genes, like the BRCA1 or the BRCA2. You all may have heard of those. Those are genes for like ovarian cancer and breast cancer. But then that test also checks for other genetic mutations as well. So if this is your first time hearing about this, ask your healthcare provider about it. Say, how can I get, my testing done to check to see if I have any type of genes in my blood? Also, mammogram. That's right, ladies. Go and get your mammograms done once a year. I have several patients that say, oh, I'll skip this year, I'll go next year. Unfortunately, I've had patients a year later that I've had to diagnose with breast cancer. I mean, the year before, they were perfect. Everything came back fine. But that next year, they were diagnosed with that cancer. So don't skip a year. The recommendations have not changed yet. They're trying to change it, but I still advocate for that yearly mammogram. Also, your ultrasounds that are out there. All right, so a lot of times you'll go for the mammogram first, and if they see something wrong, or they see dense tissue, which a lot of women probably have gone through this before, but the mammogram, sometimes it's too much tissue, breast tissue. We got a lot of breasts, right? Some of us, huh? So you go for the mammogram, but they can't quite see. So they'll order an ultrasound, which checks the breast tissue more in depth to see if if they did see a lump, they'll say, okay, that was just a cyst, or that was just a benign tumor. That happens more than you know. So if your mammograms come back up normal, don't be scared. Just go through the movement there. Go for that ultrasound because that's important. Now, I also have a lot of my naturalists that loves, they don't want any radiation. No, I don't want to do any mammograms or any ultrasounds. So there is some type of screening out there. It's not FDA approved, but I want you to get something done. Because again, early detection is what? Key. That's right. So thermography is something that you can get done as well. And that's not FDA approved. It's not going to be covered by your insurance. But that's something that it just basically looks at the inflammation of the breast. And it sees any areas that's like heat sensitive. And then if it's inflamed in certain areas, then that may warrant, further investigation. So that's something else that's out there. Also, your breast self-exam. Everybody say your breast self-exam. Now, this is for men and women. You all have to check your breast. Men, check your chest, okay? But you have to check this. Now, for my females, I always say 2 weeks after your period. Don't check it before. You want to check it 2 weeks after your period. The reason why is because we get hormonal cysts. You will get scared if you check your breast a week before your period. And you feel something, usually that's because of the hormonal changes our body goes through. So check your breast 2 weeks after your period. Men, of course, you can check it anytime. So that's important to do. Do it in the shower, soapy breasts, go up and down. It's about getting familiar with how your breasts feel. A lot of my patients will say, oh, I don't know what I'm feeling for. But guess what? If you're checking your breasts, if you're touching yourself, that's right, don't be afraid to touch yourself. If you're touching yourself monthly, you'll be able to identify changes. So don't be scared, okay? Don't be scared because you have to know what's going on the inside of your body, on your body. A lot of times I have a lot of patients come in and then I'll see like this mole or tag on their skin and I'll say, how long have you had this? Oh, I never noticed it. Not good. You should know every single detailed part of your body. So start doing your breast exams. Also, let's go into, so I talked about what? Family history, you need to know that. Genetic testing, getting your mammograms, ultrasounds, breast self-exam. We can't forget about that diet, y'all. Diet is so important. Say, diet is key.
Diet is key.
That's right. Now, I know you all always hear it, but it's true. A diet that's high in saturated fat, such as your beef. How many of y'all eat beef in here? Some of y'all ain't raising y'all hand. All right. And then pork, you got to stay away from the pork. certain cheeses, also poultry. So, you just want to eat a diet that's lean, all right? Lean fats, healthy fats. Stay away from a lot, because when it comes to the reason why those saturated fats, they increase estrogen within the body. And when it increases estrogen in the body, we don't want too much of the estrogen, because that's what precipitates the cancer to grow. You all know we have cancer cells in our body, right? We all have it. It's just certain things trigger the growth of these cells. So watch what you eat. Obesity, exercise, weight loss, all of that really, really interferes with your body being healthy. You gotta make sure you stay active. I promise you'll feel better physically and mentally as well, as she spoke about. Also, avoiding a lot of caffeine, that's sugar, that's coffee, that's tea, that's chocolate, and that's sodas. How many of y'all drink that? All right, yeah. I have some people that say, oh, when I mention caffeine, they say, oh no, I don't drink coffee. But we can't forget about those teas. A lot of my islanders love teas, but teas are high in caffeine as well. So you have to watch that as well. The reason why caffeine is because it causes increased breast tissue. It causes a lot of lumpy breasts. And sometimes that can obscure when we